Hello, I'm Claire.
And I'm Lizzie, and we're pelvic health physiotherapists.
So in this session we are going to cover various aspects of everyday activities. For example, we know people with pelvic girdle pain often struggle getting in and out of bed, turning over in bed at night, getting comfortable due to either hip discomfort, back discomfort or pubic bone discomfort. So we're trying to show a various range of positions that you can sleep in. So we're going to start with bed mobility. So I'm going to talk you through it and Lizzie will be able to demonstrate. Remember, the key thing here is to use your pelvic floor muscle to help brace that lower part of your pelvis as you do your movement. So what we're trying to do is avoid twisting getting into bed in this position. That puts a lot of strain on the lower tummy muscle, as we know that tummy muscle has already stretched and is under more increasing load. So what we want to do is just take it nice and slowly, pull up the pelvic floor, come down onto the elbow, bring up the legs and pause. Just rest in that position. Don't be in a rush. Then when you want to turn onto your back, pull up your pelvic floor again, using your arms, but also using your feet to push down into the bed, lift up that bottom and roll over. And then if Lizzie was going to turn onto the other side, she would repeat the same. Alternatively, we want to get back out of bed. Again, we want to push down through the feet, raise the bottom up, and start to turn onto the side. Use your pelvic floor to help you support your pelvis. To come back up into sitting, we'll do the reverse. Pull the pelvic floor up, lower the feet, use the arms, push down. Don't let the strain be through the tummy or the lower back. So, other ways of moving around in bed. So Lizzie, we'll just get you onto your side again. Some women find it really uncomfortable to roll onto their backs to turn. So what we can do is actually to go onto our hands and knees to then turn sides. So Lizzie's going to demonstrate pulling up the pelvic floor, onto the hands and knees, and coming across this side. Again, if we just reverse that, onto the hands and knees, pull up the pelvic floor, we don't have that twisting motion of the pelvis. Now the other way you can do it, again if you don't want to turn, is you could take your pillows to the other end of the bed and just flip over sides. I appreciate the duvet may be scuffled up at this point, but it may just be an easier movement for you to make regarding how much, or considering how much pain you're in with your pelvis at the time. So it's least pressure possible through your pelvis. So what we have to consider is when you're on your side sleeping, what actually we can do to help the pelvis and the back. And it's important to notice that when we often go on our side to sleep, our knees are lower than our hips and we start to get a bit more of a twisted motion coming around through the back. So what we can do to help this is to put a pillow in between the leg so that the hip and the knee rests at the same level. And this also takes pressure off the pubic bone directly. So if you are getting that pubic bone pain, especially at night, keeping the leg further raised or raised up will help offload the pressure coming through the joint. If you, however, have lots of pain around the hips, you are really quite stuck because you can only sleep really from one side to the other. So to sometimes help take the pressure off the hips, we can ask to further straighten that bottom leg and comes backwards, so it takes the pressure off the side part of the hip. But as you notice, this top leg has now dropped forward. So you may then need to have more than one pillow just at the front of you. Again, Lizzie's knee is slightly too low still, so it may be a third pillow is needed depending on the size and the thickness of your pillows at home, just to keep this knee and hip supported. But actually around the back there's less pressure going directly through the hip joint. Another thing to help with this is if you were to get a duvet and to fold your duvet in half and put it underneath your base sheet, you're in fact padding out your half of the bed, so it gives you that extra cushioning around your hips where you may be experiencing the pelvic girdle pain. So as we go back up into sitting, Lizzie, we're going to take the pillows out, But just to reiterate, going onto the side, making sure there's minimal strain through the tummy muscle. Use your arms, big strong arms, push up and come up into sitting. So if we consider the tummy muscle again, what we really must make sure is that when we are changing our position from laying to sitting, we do not put too much pressure through the tummy muscle. So you may notice an excessive peaking or doming of your tummy muscle as you change either from laying to sitting or sitting from laying. And this can be known as tummy muscle separation or diastasis of the rectus abdominal muscle. And we have a separate booklet on our website to discuss what a diastasis is and how to then look after the diastasis in pregnancy. And it is something that can be looked at after you have delivered and you can get further help with from the physiotherapy women's health team.